From the House of Commons tonight is the Lib Dem MP and their spokesperson for health and social care, Norman Lamb, a health minister under the coalition government. In North London is Labour MP Luciana Berger, a member of the Commons Health Committee and president of her party's campaign for mental health. And joining us from Westminster, Dr. Andrew Murrison, Conservative MP for South West Wiltshire. Let me just start with you, Norman Lamb. How do you stop what is an acute shortage of nurses coupled with an acute shortage of funding? How do you stop that tipping over into cancer care, despite the government's pledge that it won't happen?
Well, I'm not sure that you can. And in a way, it's right that you identify the problem in that way, because what we're now starting to see with this story today about cancer care has, I'm afraid, been routine in mental health care, for example, with patients routinely not getting the full evidence-based treatment that they should get. So this is already endemic across the NHS. And ultimately, this is not sustainable. We can't carry on like this. And it will just keep getting worse and worse. People will be left waiting longer and longer.
Let me pause you there, and I'll just take two quick answers from the other two MPs present. Luciana Berger, how do you stop a shortage of nurses and shortage of cash combining to tip over into eroding cancer care?
We need some urgent and immediate action. Plans aren't good enough. We need the injection of funds that we desperately need right across our health service for this winter immediately, particularly to, as we've heard just in the last few weeks, this issue about those operations that are being cancelled. We need the funds and resources going in to ensure that we've got the care that we desperately need, and that includes ensuring that we can bring people on from bank if necessary in the short term, but actually having much better medium and long-term plans to ensure the sustainability of our NHS when we celebrate its 70th year.
I can hear the Health Secretary in my ear, effectively, saying, hang on a minute, we've already put winter payments in. Dr. Murrison, they were not enough.
I agree, and that's why I've called for a fundamental reappraisal of the way that we fund healthcare, because we need to get more money into healthcare. You cut it whichever way you like, but let's point out also that we have more doctors, more nurses, more money, better results, including from cancer, than ever before. So we do need to celebrate the positive, as well as, of course, trying to improve things.
But I had the Health Secretary here last week, and he said, we've put the money in. It may not be enough, but we put money in. It seems to have had no effect.
The difficulty for me, and I suspect Norman would agree with me, is that our results are not good when compared with countries like France and Germany and Denmark and Norway. And we need to get funding up to those sorts of levels, and then I think we'd find that outcomes go to the levels expected as routine in those sorts of countries.
Well, now, the next area I want to explore with all three of you, and I'll start with you, Luciana Berger, is what can be done to ensure this doesn't keep happening year after year after year? It's worse this year. It was advertised for 3 years and still didn't stop it happening. What needs to be done? Luciana.
Well, we've seen a sustained decrease. We've seen a sustained decrease in the proportion of our GDP that's been going into our health service since 2010. At the moment, we've got over 100,000 vacancies across the National Health Service. We've seen a reduction of 14,000 beds. In order to fix the problem, first of all, we need an acceptance from this government that the problem actually exists. And the response that I had from the Prime Minister today in PMQs suggests to me that they haven't even accepted that we've got this problem. They've established this green paper for health and social care, which we have been told won't come out now until the end of next summer. What we need is a very, very quick and rapid cross-party approach to this to come up with a sustainable solution to our NHS to ensure that it does have the adequate funding, not the cuts that we've seen, but a significant proportion of our GDP to ensure that we've got services for our physical health, mental health and social care all together integrated right across the country.
Dr. Murrison, how would you deal with this in the long term? The other day, the Health Secretary said to me, we need a 10-year plan. And every year, every 10 years, we have a new plan.
Yeah, he's right. We do need a 10-year plan. We're working with a 5-year plan at the moment, Simon Stevens' 5-year plan. We need also to nail this idea there have been cuts to healthcare. There simply haven't been. There's more money going into healthcare than ever before. But I think there isn't enough because demand is escalating all the time. And we need to deal with that and how to put it on a sustainable footing, which is why I and others are calling for a Royal Commission into this. We'll report in fairly short order on how we can get the system on a sustainable footing and make sure we get cash going into the NHS in a way that is routine in other healthcare economies.
But Dr. Murrison, I hear the words long grass.
No, not long grass. So Royal Commissions have a history of being a way of kicking things into the long grass. This is urgent, but we need to do it properly. And this year, of course, the 70th anniversary of the NHS is a good time to do it.
Norman Lamb, would you sign up to a 10-year plan and would you sign up to a Royal Commission?
You absolutely need to have long-term planning and instead of lurching from crisis to crisis. I coordinated a letter signed up by 90 MPs just before the budget in the autumn. I think Luciana and Andrew both signed up to it. We were calling for what we called an NHS and Care Convention. I think there has to be something that's strictly time limited. The danger with the Royal Commission is if it drags on for 3 or 4 years, that just doesn't recognise the urgency of this. So I would say a process that lasts no longer than a year, that engages people across the parties, critically engages the public in some of the tough choices we've got to make about how we fund and secure our NHS and care system. But the bottom line is, although there is more money, as Andrew says, than ever before, it's not keeping pace with demand.
Right.
Demand's rising about 4% a year, money going in is about 1% a year. That means we have a crisis, and if we carry on as we are, then more and more families will be dreadfully affected across our country.
Luciana Berger, I can hear patients and relatives pleading that the three of you, three parties, bind together and go above politics and solve this thing together. Is there any remote possibility to do that? I can even see Dr. Murrison nodding.
I certainly think there is. If we can see some acknowledgement that the crisis and the problem exists, and an acknowledgement that we can arrive together at this solution. The will, I believe, is there, and we now need to see some urgent action from this government, because we cannot see things like we've seen on the front page of the Times today, with people facing the prospect of being denied cancer care.
Right, but
we need an NHS free at the point of use for everyone that needs it.
Let's get practical. I mean, would you sign up to an increase in national insurance by, I don't know how much it would require, but some kind of across-the-board increase in contributing to the health service? How do you get this money? It doesn't grow on trees.
I very much agree with...
There's lots of different...
I very much agree with the idea of a dedicated, we call it a hypothecated tax for the NHS and for care. And I think if it could be based on a remodelled national insurance, you have to make sure that it's fair between the generations.
OK, I've got that from you, so will I get it from Dr. Murrison?
Well, I think we need to nail the idea, too, that this should be cross-party. It needs to be above party. That's very... The two are very different.
And the money?
Which is why a Royal Commission would be sufficiently authoritative, and is why I think the Royal Commission is the right way
Luciana Berger?
I'm attracted to hypothecated taxation for health and
social care. The two attracted to hypothecated taxes. Luciana?
I think there's lots of different options. There's a number of options that can be considered, including a levy on employers, including a hypothecated tax. There's various different options that have been put forward. I definitely would accept and support anything that would ensure that we will have an NHS which has funding on a sustainable footing into the future. That's not what we have at the moment. Any of those options would be something to very seriously consider and go forward
OK, well, we really do have three tripartite interest in a long-term solution. All we now need to find is emergency funding now. What are you up for? Dr. Murrison.
Well, money is going into the system. I personally think there should be more, but I have to say I admire the planning that has gone into dealing with winter pressures this year. So the first time in the 30-odd years I've been involved with healthcare, we've had some sort of rational planning for the pressures we get every single year at this time of the year. And I think managers in the NHS, who always come up for a lot of flack, need a lot of credit, and ministers, for putting this in place for pretty much the first time.
Luciana Berger, I see that our tripartite agreement is breaking down. What's the problem?
No. The challenge is that it was too little and it was too late. And the money that was brought forward, we had at the Health Select Committee, Jim Mackey, the head of NHS Improvement, tell us back at the start of October that the money that was put into social care, they knew back in October, wasn't enough. They knew it was going to be a very, very pressured winter. And back then they said that demand was going to outstrip supply. So in spite of a bit more money going in, we have to acknowledge the cuts that we've seen in real terms to our NHS since 2010.
Okay.
And it's not fair to say that the money that went in was enough to actually close the gap and make sure that we didn't see the crisis.
Norman Lamb, you were in that department.
Right. Yeah.
Will adding social care to the Health Secretary's responsibilities cure this problem?
Look, this is total window dressing. The Secretary of State for Health has already been responsible for social care. I was the minister in his department responsible for social care. It's just adding that name to his title. It does nothing more than that. We have to now see substance of bringing the NHS and the care system together so that people get joined up care. And on your point about how we get extra money in straight away, the Lib Dems have already made the case for an extra penny on income tax, which would immediately bring in £6 billion a year extra, which would make a big difference to a system under massive strain.
Well, can I thank all three of you for being generous with your time, generous too in being prepared to share some views that you will agree with and continuing to disagree on some others. Luciana Berger, Norman Lamb and Andrew Murrison, thank you very much indeed for talking with us. Thank you.